Melatonin is effective for insomnia, but did you know that it has other health benefits besides sleep, such as boosting the immune system? In this video, we'll be going over the types of melatonin, how melatonin is synthesized in the body, causes of decrease in melatonin production, benefits of melatonin other than sleep, how much melatonin you should be taking, and research findings on melatonin. Stay tuned to find out more about the non-sleep functions of melatonin. Melatonin can be made in different ways, such as synthetically, extraction from animal brains, and extraction from fermented plants. There are two types of melatonin, sustained release and immediate release. The difference is that the sustained release is more likely to keep you awake the next day than the immediate release of melatonin. Melatonin gets produced in the human brain part called the pineal gland. Melatonin is produced in response to darkness. Therefore, if there is more light that hits the retina of the eye, such as sunlight, electric bulbs, TVs, or computers, they can inhibit the melatonin synthesis. If you've ever wondered why you sleep more easily in your childhood, the pineal gland produces about 0.5 to 0.8 milligrams of melatonin until your teenage years, and after that, only 0.3 milligrams of melatonin is produced per day. Causes of decrease in melatonin production. Melatonin production declines with poor diet, irregular lifestyle, and by age, especially over the age of 50. Irregular lifestyle can be frequently traveling abroad or having different work shifts every day. Those who work night shifts are prone to having decreased melatonin production, and scientists recommend them to take melatonin to improve their sleep disorders and their health. Some of the medications that lower melatonin production includes antidepressants, anti-inflammatory drugs, beta blockers, and calcium channel blockers. Substances such as caffeine, tobacco, and alcohol can also lower the melatonin production. Not only does melatonin aid in sleep, it also has other health benefits. Melatonin acts as an antioxidant to reduce free radicals. Free radicals are bad for your body because they are unstable atoms that can damage cells, possibly causing illness and aging. Melatonin is considered a stronger antioxidant than vitamin C because they can cross the blood-brain barrier to protect the brain from free radicals. Since melatonin can perform such a unique action, studies believe that they may help prevent brain atrophy, dementia, and Alzheimer's disease. Now, how should you take melatonin? Excess melatonin intake may cause lethargy and drowsiness. If you like to take high doses of melatonin, increasing the melatonin intake gradually is recommended. Melatonin induces sleep by lowering body temperature. If you're too cold, it's a sign of too much melatonin in your body. It's ideal to take an appropriate amount of melatonin dosage, slightly lowering your body temperature. Melatonin breaks down quickly in each person's body, therefore different dosages are necessary for each person. A certain amount of melatonin must be taken every night for insomnia because it breaks down so easily. Benzodiazepines deplete melatonin, sleeping pills, and psychiatric drugs, and act on a neurotransmitter called GABA. If you have used these drugs for a long time and cannot sleep naturally, try consuming melatonin. Studies have found that melatonin for cancer had benefits after using doses as high as 20 milligrams. Research findings on melatonin. Between two groups of athletes, the melatonin-treated group had lower oxidative stress markers and lowered inflammation and injury than the group that did not take melatonin. A group of patients with metabolic syndromes had not improved their cholesterol and blood pressure after 3 months of lifestyle and dietary modification alone. However, after taking melatonin, improvements were seen in bad cholesterol and blood pressure within just 2 months. Studies on the effects of melatonin on dementia have shown improved cognition, memory, and sleep duration. Studies have shown that melatonin prevents the aggregation of beta amyloid, which causes Alzheimer's disease. Melatonin can improve cognitive, performance in that regard. Melatonin levels have been found to be low in autistic patients, and melatonin improved their sleep and daytime behaviors. Patients with neurodegenerative disorders have mitochondria that's easily damaged by free radicals. Melatonin can be absorbed by mitochondria and protects them from free radicals. Melatonin boosts the immune system. High melatonin concentrations have been shown to stop the growth of metastatic cancer cells and improve the quality of life for cancer patients. Melatonin has been shown to improve the function of the valve between the esophagus and stomach. It also relieves gastric acid reflux disease. Did you learn something new today about melatonin? If you're interested in our melatonin supplement, it will be linked in our bio. Make sure to follow us on our socials, they'll all be linked in our bio, and don't forget to subscribe. Thank you so much for watching, and we'll see you in our next video.